When you ask somebody to write a prescription for an antibiotic, they write what they're most comfortable with. The ones that they're most familiar with, that they've been using for the longest time. They know it's effective. They know it's adverse events. There may be competitors for that one, but if they're comfortable with that, then they want to use that one. That's wonderful. That's exactly the way the art and science of medicine works the way it does. We want you using what you're comfortable with and that you think you have a good handle on.
Well, that's as an ordering physician, but as a radiologist reading those images, wouldn't you want to have more of a say-so, more of an influence of what contrast is given?
It's a fascinating question. As somebody who started out in surgery, then went into medicine, then went into radiology, this is my patient.
Right.
I don't want to say so. I want all to say so. This is my patient. So I want complete control over what I think is best for my patient, and I want to discuss it with my patient, and that patient and I will determine what's best for them. The more anyone else tries to butt into that, the more frustrated I personally would be. But I recognize the reality of the world. The reality of the world has many, many limitations placed on that scenario. The biggest one is the Stark Amendments. The Stark Amendments were passed years and years ago for good reason, if you don't mind my editorializing, and they were anti-kickback. The Stark Amendments was essentially state that any physician, it's not radiology, it's any physician, no physician can financially benefit from a test that they order. No physician can financially benefit from a test that they order for their patients. I think you need an upper GI. Luckily, I happen to have a scope. Let me do it on you. They're concerned about the potential conflict of interest that maybe I'll order if I could earn money by ordering a test. If I have a system that will analyze blood work, blood chemistries, I might order a lot of blood chemistries on patients that maybe perhaps might not need them so that I can do them in my lab and I'll feel like I'm doing good medicine, but at the same time, maybe it's not really indicated and somebody else wouldn't have done it, and I'm being somehow swayed by the potential profit of having the machine and charging for it. So the Stark Amendments do not permit a physician to benefit from a test financially, from a test that they themselves order. I can order an upper GI and send them to you, and you can perform the upper GI. As long as there's no financial relationship between us, that's of course the practice of medicine, and that's fine. As a result of the Stark Amendments, a radiologist cannot order contrast on their patients because a contrast-enhanced examination reimburses more, and I would financially benefit than an unenhanced study. So ironically, the biggest expert in the hospital as to how to use these tests is the radiologist, because they are the imagers.
Right.
But since they can financially benefit, they've been cut off. And we have to pick up the phone and call daddy. Hello, referring physician. Your patient needs a contrast-enhanced study because I think this is an abscess. Can you please order contrast so that I can give contrast and bill for it and be reimbursed for it because that's what is appropriate for your patient? Sure, Manny, I'd be glad to. So that it's an unfortunate, necessary evil of the Stark Amendment.